6 signs of stroke in women. Every year almost 140,000 people die from stroke and its complications. Although strokes are more common in men, but women are more likely to die from a sudden stroke. Surprisingly, stroke is the third leading cause of death for American women. Research conducted by the Center for Disease Control and Prevention shows that 1 in 5 American women have a stroke, and on average 60% die from the attack. Not only this, strokes are more silent and sudden in women as compared to men. So, it's important to know all the signs of stroke specific for women, although some of them are common for men too. Before we begin, don't forget to subscribe to our channel and hit the bell icon so that you won't miss any of our amazing videos. So before starting signs and symptoms of stroke, it's important to know what causes stroke in women at first place. Excessive use of contraceptive pills, chronic smoking, obesity, complicated pregnancy, and high blood pressure are some of the most common causes of stroke in women. If you have any of these, this video is for you and make sure to watch it till the end. Now let's move on to the signs and symptoms of stroke. Number 1. Headache. Headache is a very common condition we all suffer from. Some women suffer from a condition called chronic headache, where the problem lies in the blood vessels of brain, creating resistance in blood flow. While it's so common, remember, it can be sign of stroke too. Stroke can be either hemorrhagic or ischemic. In hemorrhagic stroke, a blood vessel inside brain gets torn apart and blood leaks into the brain substance. While in ischemic stroke, blood vessel inside brain gets clogged, just as in case of heart attack. In either case, a common symptom that will happen is sudden and severe headache. If the headache starts suddenly and is so severe that you lose your ability to concentrate, it might be because of a stroke. Simply put, if you are feeling a headache so severe that you have never felt before, call 911 or any other emergency service immediately. Number 2. Sudden numbness. The medical term for numbness is paresthesia. It is an unusual sensation that generally happens in hands, feet, arms and legs. If you are an aged woman and you feel numbness in any part of your body, then it might be a sign of stroke. Now we are not talking only about not feeling a part of your body. Numbness and stroke can also feel like a pricking sensation in your legs after sitting for too long or falling asleep on your arm. The pricking sensation we are talking about happens a lot of times. And we bet that you also know the feeling of it. But if you feel regular numbness of your face and your limbs, most likely on one side of your body, then surely you need a medical checkup. Number 3. Weakness. We all feel tired after doing a long run or a strenuous gym session, but we are not talking about this here. Muscle weakness in stroke occurs when your effort doesn't produce a normal muscle contraction or movement. This happens if your nervous system or the connection present in it are injured or affected by some disease. Muscle weakness caused by a stroke will mostly involve your arms, legs, and face. If you feel your face more deviated to one side, saliva dripping out of your mouth despite the full effort to close your mouth, not being able to lift your arms or legs when you want to, this should raise alarm. And as we already told you, if it's only one-sided, you need to visit your family physician immediately. Number 4. Trouble seeing. Stroke is also known as a brain attack, just like the heart attack in case of heart. It occurs when blood flow to the brain stops and the brain cells in that area begin to die. This can affect the entire body including your eyes. Trouble in seeing with one or both eyes is a common symptom, especially in women. So if you start feeling anything like that, you should consult your doctor right away. Although there are some other pathologies that can cause blurred or double vision too. But if it happens suddenly, it might be because of an imminent stroke. Number 5. Dizziness. Dizziness is the sensation of being lightheaded, woozy, or unbalanced. Sensory organs, especially eyes and ears, are affected most by dizziness. This is not the disease, but rather a symptom of stroke among other disorders. Now this is another feeling that most of has gone through already. You'll feel like the room is spinning, you are going to fall, and a sense of losing balance. Although the most common cause of dizziness are ear infections. But remember, ear infection isn't a thing that'll make you dizzy for a month or two, while a clot progressively developing in your brain vessels can. So, if you ever feel dizzy again for a longer period of time, it's time to get yourself checked by a doctor. Number 6. Confusion. Confusion, also referred to as disorientation, is a symptom that makes you can't think clearly. You might have a hard time focusing and making decisions. If you ever feel that you used to be more decisive in the recent past and just can't focus anymore like before, it might be a sign of stroke which is developing. If you or someone in your friends is confused for a long period of time, discuss this condition with your doctor. What to do in case of stroke. Symptoms of stroke are unique because they come on suddenly, without warning. Although you can look for certain signs like your mouth starting to drop on one side, weakness that's slowly progressing, and headaches that are more in intensity and severity than before. Researchers of the National Stroke Association suggest using the word FAST to help you recognize common stroke symptoms. Here F stands for face drooping. Smile and see if one side of your face is drooping. This side of the face may also be numb, and the smile may appear uneven. A stands for arm weakness. Try to raise both of your arms. Is there weakness or numbness on one side? One arm drifting downward is a sign of one-sided arm weakness. S stands for speech difficulty. People having a stroke may slur their speech or have trouble speaking at all. Speech may be incomprehensible. And T stands for time, to make an emergency call. If you feel the above symptoms, call 911 or any other emergency service available. Even if the symptoms go away, call the emergency service and get yourself to a hospital immediately. So, these were the signs and symptoms of stroke in women. But don't leave yet, as we have some important information for you. Remember, the warning signs of an ischemic stroke may be evident as early as 7 days before an attack and require urgent treatment to prevent serious damage to the brain. So when it comes to a stroke, every second counts. The longer you wait, the more likely it is that the stroke will result in brain damage or disability. If you get to the hospital within 3 hours of the first symptoms of an ischemic stroke, you may get a type of medicine commonly known as thrombolytic agent. This can break up the clot causing the problem and even reverse the damage in some cases. A common thrombolytic used is tissue plasminogen activator, which improves the chances of recovery from the stroke. In case of hemorrhagic stroke, where the main issue is blood leakage into the brain tissue, doctors focus on stopping the bleeding vessel first. This may even require surgery and removal of blood by the surgeon. Look for all the signs in the video and take care of yourself and your loved ones. Don't forget to like this video and also subscribe to our channel and hit the bell icon so that you won't miss any of our amazing videos. You can also watch our other videos suggested just for you.